Be thankful for modern medicine. Because just a few centuries ago, a headache could get you drilled, an infection might involve maggots, and surgery was performed with zero anesthesia. In today's episode of MindBreach, we're diving into the most bizarre, painful, and downright horrifying medical procedures from the past that will make you grateful for your next trip to the doctor. 1. Trepanation, drilling into the skull. Let's start with a classic, trepanation. Ancient doctors drilled holes into patients' skulls to release evil spirits, treat head injuries, or relieve pressure. No anesthesia. No antiseptics. Just sharp stones or bronze tools and a lot of screaming. Shockingly, some patients survived, long enough to get a second hole. Some ancient skulls show signs of healing, meaning the patient lived through it. 2. Bloodletting, the universal fix. Got a fever? Cough? Depression? Medieval doctors had one answer: bloodletting. They believed bad blood caused illness, so they cut open veins or used leeches to drain you. George Washington died after losing nearly 40% of his blood this way. Some barbers even doubled as surgeons, offering a quick shave and a side of bloodletting with your trim. 3. Tooth worms. Before bacteria were discovered, people thought cavities were caused by tiny worms living in your teeth. To treat it, they'd burn herbs near the mouth to smoke out the worm. Others drilled into teeth and poured acid in. Spoiler, the pain didn't stop. There are even ancient Sumerian texts describing these tooth demons. 4. Hemoglossectomy for stutterers. Stutterers in the 18th century were sometimes treated by having part of their tongue cut off. This brutal surgery, called a hemoglossectomy, rarely improved speech, but it guaranteed pain, blood loss, and often infection. The procedure was done without anesthetic. Imagine biting down on a stick while someone slices your tongue. 5. Ancient Egyptian enemas. The Egyptians were pioneers in medicine, but some of their ideas were strange. They believed regular enemas were the key to good health. Doctors used reed tubes to inject mixtures of honey, water, and sometimes fermented beer directly into the rectum. And yes, this was done routinely. They even had a god of enemas named Shesmu. 6. Scrofula. The king's touch. Scrofula was a disfiguring illness, and for centuries, people believed it could be cured by the royal touch. Monarchs would literally touch or stroke sick people during elaborate ceremonies. This practice continued for hundreds of years, and thousands lined up just to be touched by royalty. 7. Boiling oil for wounds. During the Renaissance, doctors treated gunshot wounds by pouring boiling oil directly into the injury to cleanse it. This often caused more harm than good, and frequently led to infection, gangrene, or death. French surgeon Ambroise Paré changed this by trying a gentler treatment of egg yolk, oil of roses, and turpentine, and discovered patients actually lived. 8. Heroin for kids. In the late 1800s, heroin was marketed by Bayer as a cough suppressant and safe alternative to morphine, even for children. It was widely sold in pharmacies. Ads even featured children with glowing reviews. It took decades before the dangers and addiction were fully understood. 9. Burning hemorrhoids off with a hot iron. Before modern creams and laser surgery, hemorrhoids were cauterized. That means doctors would take a red-hot iron rod and literally burn them off. No numbing, no pain relief. Just medieval fire therapy straight to the backside. 10. Crocodile dung contraceptive. The ancient Egyptians believed inserting crocodile dung into the vagina would prevent pregnancy. The idea was that it created a barrier, like an early diaphragm. It probably also caused a lot of infections, but hey, ancient problems, ancient solutions. From skull drills to dung contraceptives, these ancient remedies make modern checkups look like spa days. Which one shocked you the most? Drop it in the comments, and don't forget to like, share, and subscribe to MindBreach for more bizarre knowledge from the edge of science and history.